Thank you for tuning in to the HealingUs Podcast. Today we're joined by Ashley Close of Wellbridge Treatment Center. Ashley's been in the field of outreach, specifically in the addiction treatment industry, for over 10 years and brings so much knowledge and experience. So thank you for joining us today.
Thank you for having me.
Awesome. So tell me a little bit about, your journey through it with your family and kind of what inspired you to get involved in the field of addiction. It's not a job that everybody finds. So what got you here?
Absolutely. So, gosh, my path isn't traditional to some of the people that we know in this space. Having, lived personal experience, for me, my plan was not to work in the sector traditionally. I mean, when I was in high school, my plan was to go into the Navy and then, complete the Navy, serve my time, and then become a police officer in my local community. My aunt was the chief of police in Keyport, New Jersey, and that was my plan, to follow in her footsteps. But, God had another journey for me. I got pregnant with my daughter super young. And I didn't really know what I wanted to do after I had her. So I went back to school and I started taking some college courses at a community college, and thought I'd continue on with criminal justice, but that just wasn't my plan. My dad was the clinical director for the first agency I ever worked at, and he just was sick and tired of me complaining consistently about I don't like this, I don't know what I want to do. And he's like, well, you need a job. Welcome to the world. You're a mother now. You're 19 years old, and you're going to take this $13 an hour job as a overnight behavioral health tech, and we're going to figure it out from there.
Good for him.
Yeah.
Put you right to work.
Tough love,
Yeah.
My dad from the beginning of early childhood has always come from the school of hard knocks, tough love always. You're going to work for everything that you have. So here, you have a kid, you're a kid, welcome to the world, you're going to work. And honestly,
he's in recovery as well, your dad,
yeah,
right?
yeah, my dad's in recovery.
Awesome. So he threw you right in. You started behavioral tech, worked your way up. You've been doing outreach for a while.
Yeah.
You have a lot of experience in it.
Yeah, absolutely. So I've been in outreach for, probably going on 7 or 8 years now. I started my career at 20 years old. I'm 32 now. I started as a behavioral health technician. I worked, in different capacities within different agencies, whether it be an intake coordinator. I did administrative assistant work, quality assurance. I did all of the things outside of being a clinician or a nurse or medical provider. So I kind of just stepped into outreach by way of working in admissions. The agency I worked for fell in love with my ability to connect with people, and they said, go, get out on the road. We want you to be the face of our agency. And although I was terrified, I fell in love with the work and making the connections.
That's awesome. And it's not an easy job, that's very demanding on your hours and your personal time. There's not much work-life balance.
Yeah.
So I'm sure you can, relate, especially as a young mom and everything else that's going on in your personal life, how challenging that was. So to talk to me a little bit, how has your, idea of addiction changed since being in the field?
Wow. I feel like it's evolved, right? So I've been in the field over 10 years. And when I first got into the field, my idea of addiction as a whole was just something that people struggled with, right? So I was the kid in the back of AA meetings. I knew the Serenity Prayer better than I knew my ABCs. Addiction was a symptom of pain. That's how I always knew it. And that's still essentially how I see it, is it's a symptom of some sort of pain, whether it's old pain, new pain, pain that you've not identified yet. It's a symptom of pain, right? We abuse drugs and alcohol because of what we've been through. I think what's evolved for me in terms of just addiction in the space is just education and progression. And, when I started in the field, medicated assisted treatment was extremely frowned upon. I mean, not to call my dad out or anything, but he got sober in AA. You know what I mean? MAT wasn't the way. You weren't really sober, and just based on data and things that we've learned is there's multiple pathways to recovery. The biggest piece is safety and making sure that we provide a safe space for people to heal.
Yeah, I mean, you started probably around the same time we did, 2012.
Yeah.
And that's where Dan's kind of journey was so met when it was when he came back to New Jersey, because he was out in California for treatment. It was met with a lot of hostility because he was really big into smart recovery and just different holistic modalities. And at that time, MAT was brand new. People were not nice about it.
What was that? Vivitrol? Was that around the time, a few years after that?
Yeah. I mean, really, all of it, Suboxone, methadone, like they were around, but they weren't as used as they are currently or were the last 10 years. Yeah.
Absolutely. I think that, you know, as a society, we unfortunately have a bad habit of getting pigeonholed in like what we know. We find comfort in what we know. And I think that we all have our own biases, unfortunately, based on our lived experiences, right? And, you know, one thing that's remained consistent as I've worked in this field is the ability to accept the things I don't know and to grow and to learn and be like, all right, let's figure this out. You know, what is the best pathway for you? That's really only for you to identify and know. My duty is to provide you safety and support.
Yeah, 100%. What are some of like the biggest challenges that you encounter? And I'm sure that's changed over time.
Yeah. There's so many, but one that's, you know, really relevant in my mind right now is just the impact on family systems and just the education of codependency, right? Like I'm working with a family right now where, you know, the individual is the main focus. The person that's struggling with substances is the main focus. However, by connecting with this family and figuring out my best way to support is identifying that the mom and the sister and, you know, the girlfriend, they're all super codependent and they're like, but that person doesn't want to do this and they don't want to do that. And it's like, no. Like we all need to work on this, and like having the ability to take a step back and not get so enmeshed and be like, okay, so I am not the expert in family systems to defer to a therapist that I love, that I'm like, this therapist and the other therapists in her practice are able to assist this family and provide them the support that they need and create the boundaries, right? Like my duty is to just always navigate, and that can be hard. Sometimes we have major transference issues. Like I can tell you, whenever I come across like, you know, an older man who's been struggling with alcohol for years, I immediately, you know, want to save them because I'm so incredibly close to my father, you know? So it's just identifying my emotionals, like what is the feelings versus the facts, and disconnecting. And it's the best way for me to be able to serve others.
And that's kind of, I guess, a great question. You know, how do you find a healthy balance? Because with what you do, addiction doesn't sleep. It's not 9 to 5. People are calling you all hours, every day of the week. You know, how do you balance that in your life? Do you balance it?
Honestly, I feel right now, you know, I may have a different answer at some point in my life, but right now I think it's communication. Once a month, my husband and I, usually the beginning of the month, we sit down, and we both have high demanding jobs, and our hours aren't traditional 9 to 5, right? Like my phone is going to be ringing on the weekends and in the evening, and it's just communication and understanding expectations. I mean, we sit down at the beginning of every month and talk about what our date nights are going to be, what our dedicated family time is going to be with our children, and then what are our responsibilities for our jobs that are absolute must that we have to attend, right? Like we're in the holiday season right now where, you know, for a lot of families, they're struggling. You know, they just had Thanksgiving and a lot of heightened emotions come up. And so my duty right now is to be everywhere, doing everything and connecting with people to be a resource. And also with that, making note of like, this is also time for me to spend time with my family. So just being really mindful of that and constantly, you know, trying to set boundaries and having open dialogue and communication. I mean, my children know what I do for work. Whenever mommy goes, shh, I have to take this call, they completely understand and they go in the next room. And one thing that I've made it a part of my daily practice is getting up early in the morning before my family's awake and going to the gym. That sets the tone for my entire day. I mean, the world is quiet. I go to the gym.
It's your self-care.
Yeah. It's really, really important.
And you feel the difference when you skip that day. Like
every time. If I'm like, oh, I just need a little bit more time to sleep, I will feel it at the end of the night when I feel burnt out and scatterbrained. I'm like, why didn't I just get up and go?
And you don't sleep as good.
No.
It's pretty wild the impact that has.
Yeah.
I've found that over the last couple months, just been like, I have to get to the gym today. Just a walk.
Just
It's
a
a
walk. That's it.
Yeah, 30 minutes.
Yeah.
So what are you doing with Wellbridge, and how long have you been there?
So I've been with Wellbridge for a little over a year now. I was super excited to come work for Wellbridge. Someone who I really admire, Dave McGinnis, is my supervisor. I had the pleasure of working for him at the last agency I was at for a few years. And so when he parted ways with that agency to start working at Wellbridge, he just was telling me about the impact that they were making in New York and, you know, the access to care that they're providing. So Wellbridge, we are a detox and residential based out of Calverton, New York. So we're in Suffolk County. So it's way out east in Long Island.
Okay. Really underserved area, though.
Yeah, absolutely. So there are some treatment centers that have been around a long time and do an excellent job, but we really wanted to be able to provide somewhere that people can get treatment and feel like they are in a place that provides dignity, safety, and respect. Our facility has been officially open for 4.5 years.
Awesome. Okay.
June 2020 is when we opened our doors in the height of the pandemic.
Wow.
So it was crazy times.
Yeah.
We had 70 staff and 3 patients.
Oh my goodness.
So we've obviously had, you know, a lot of curveballs thrown our way naturally. So a year ago when they asked me to join the team, I was super excited to spread awareness of the services that they offer and really just the education. So it's Wellbridge Addiction Treatment and Research. So we have a research department at our
Very
campus.
cool. Okay.
Yeah, where we collaborate with the hospitals. We're partnered with Northwell Health, which is for us Jersey girls is comparable to like a Hackensack Meridian. It's
Okay.
one of the
It's
bigger.
huge, yeah.
Yeah, it's a huge hospital system in New York. So with that, we share the research that we learn by way of our patients and our medical team and our clinical staff with the hospitals, with the local universities, and we're just constantly collecting data to figure out how we can evolve.
That's really an interesting component. That's
Yeah.
awesome.
Yeah.
And hopefully they're able to like really, you know, put some modalities into practice, do the research and get them solidified, because that's how grants become available and insurance accepts that, right? So,
Absolutely.
I mean, we'd love to see like certain things like massage therapy reimbursable. Like, why is that not?
I know. It's insane. I mean, we've evolved in 4 years being open, and we continue to grow. Something I'm super excited about, and it's definitely very new to me, is we opened our first responders program back in April.
awesome.
And I've never worked for an agency that had a dedicated first responders program. I mean, our campus is pretty incredible. We have 40 residential beds that are unattached to the main campus, right?
Okay.
So our first responders and healthcare healthcare professionals are housed completely separate from the rest of our patients.
That's nice, because it's really hard for first responders like to be in treatment with somebody they might have arrested or
that part.
Yeah, it's really
you know what
hard.
I mean? That
Yeah.
part. So we have a dedicated clinical team, medical team. We have a pharmacy over there. They go to the gym at different times. They're in the cafeteria at different times. It's a completely separate program. And so we're really working to spread awareness on that and make sure that people know that that's readily available. Another thing that I'd love to note about Wellbridge is we have the accessibility to help patients who have maybe a little bit more medically complex cases. If you're treating a gentleman who has been struggling with alcohol for 15 plus years and has cirrhosis of the liver, we're able to take that patient in. Dr. Hakimi is excellent, and he makes it his priority to review every single case and say, we can treat them.
Yeah, that's amazing. So I'm glad you found a place like that to, you know, proudly represent in different states. It's awesome.
Yeah.
You work closely with a lot of families.
Yeah.
What would you say to a family that is maybe struggling? And I guess what's interesting too, I'm sure you can relate to this, in the last 10 years, what's evolved is people are struggling. It used to be they go talk to somebody at their church, or like they'll talk to, you know, somebody at a meeting. Now it's they Google it, right? So we're really all kind of navigating the digital space.
Yeah.
But I always like people to know, like, what would you say to somebody that's like just sitting in that? And how do they start the journey to get out of it?
What I would say to a family struggling, you know, with a loved one or themselves with substance use is do not feel shame, right? Like, it doesn't matter that it's December 2024. We still have these, you know, stigmas surrounded around addiction and mental health and asking for help. At a granular level, asking for help feels like such a difficult task, right? It's the ability to take away the shame and embarrassment, and it's okay. It's actually really and powerful and strong for you to be able to be like, I need help. I don't have, the skills or the tools or the resources to help my loved one. Please help me. I don't know what to do. And so, Google is an excellent tool. Sometimes it doesn't really give you all the resources you need, right? So it's just, don't feel shame about needing help, and just educate yourself, right? I think that there's so many people that want to get involved in many different ways, and that's very commendable, but there so many agencies, there's so many providers, and it's really just doing the education so that you can make sure you are getting what is needed most importantly for your loved one, right?
Yeah, and just starting, I think, is really important, right?
Yeah.
Take the first step.
Yeah.
How can people get in touch with you?
Well, there's many ways. They can, reach out to me via email. They can reach out to me via phone number. I'm always answering the phone. You can call me. You can text me. If you feel comfortable messaging me on LinkedIn, you can, go on wellbridge.org and say, hey, can I please speak to Ashley Close? They'll connect you immediately to me.
Amazing. Awesome. And is there anything else that you would like to see change in the industry in the next couple of years?
I'd love there to be a little bit more regulation. That's something that's been really interesting to me, watching us grow as an industry. There are some really, really cool things that we're doing. We're super progressive in education and just where we're going with medicated assisted treatment and harm reduction. I think that it's just more regulation. I don't know that behavioral health has evolved in the way that medicine has, and so the regulations are super loose, and there needs to be some sense of some semblance of structure, right? Of like what is allowed, what is, what can we do?
Yeah, I also think like nationwide, because each state being so different, causes so many problems
and confusion.
For patients. Yeah, for staff, it's confusing.
Yeah,
I couldn't agree more. Yeah, that and just regulation and controls.
Also, if we can make it that if you are a licensed therapist who did the education, got the credentials, why are you not able to provide treatment in other states? Like if you are a licensed therapist, you should be able to treat any human in any other state virtually. Like that's insane to me.
It's not like I can understand nurses or doctors needing to retake boards, medicate, you know what I mean? But like
talk therapy,
why can't, it's crazy. I agree with you. Like it happens all the time. We have a patient that like loves their therapist, but they want to go home. Yeah. And it's not, it's across the border, 45 minutes in Pennsylvania. Yeah. And they can't stay on virtual. It's crazy. But yeah, so those are all things we got to work on. But, I appreciate you coming out and just talking about your experience and your journey and, things you'd like to see and where you hope it goes. So thank you so much for joining us.
Thank you for having me.
Awesome. Thank you for tuning in to the HealingUs Podcast. Please like and subscribe. We'll see you next week.